Okay, perfect. Well, hi Griffin. Thanks for meeting with me this morning. Both
Mhm.
of our internships are just kind of wrapping up since it's the end of the summer. So yeah, I
Yeah.
just wanted us to have a little bit of time to discuss kind of the work you've been doing in more detail, to maybe share some insights for any future interns, who might be watching this, or just anyone who's kind of more tuned into the policy side of things. So yeah,
Mhm.
I would just love to go through a few reflections with you if that sounds good.
Yeah, it sounds great.
Okay, cool. I guess just to get started, I'd love to kind of just hear about your internship and the work that you've been doing in a bit more detail. So kind of like an overview of what you've been working
Mhm.
on, what you learned, things like that.
Yeah. So over the course of this internship, I've worked on a research project about Medi-Cal utilization. Basically how clients and just other people in general are able to sign up and use Medi-Cal, like how are they able to use it best? Where can I apply? What do I need to apply? How long this process takes? What are some of the challenges that
Yeah.
people face when applying? Like what community organizations can help?
Mhm.
And just a bunch of other questions like similar to that, mainly focusing on sort of the challenges that I would expect people to have when applying for this program.
Got it, got it. And then, um, would you say your work focused mostly on Medi-Cal, or did you kind of branch out to Medicaid more generally around the country?
I did a little bit of both.
Mhm.
I would say I focused a little bit more on Medi-Cal just
Yeah,
because it's a lot more like specific to our location.
exactly.
Um, but I also did a little bit of Medicaid research, or Medicare research just because um, the big beautiful bill had just recently passed, and I wanted to know what the effects of that were. And
Yep.
so I wrote a little bit about that, and just how much of an effect there would be
Hmm.
post cuts, and sort of what changes we can expect because of that.
Yeah, just out of curiosity, what were some of those changes that we might be able to expect?
Yeah, so I think the biggest one is the 80-hour a month work requirement that is required now. And that's just sort of a big hurdle that like people who are involved in the justice system may face just because they might not be able to find steady work, they might be
Mm.
out of a job. It's sort of very difficult to prove that you are in between jobs or just are having trouble finding a job. So being
Totally.
kicked off like Medicare is just like it's going to be really hard for them if they aren't going to be able to meet that requirement or be able to qualify for any of the exemptions. So that's going to be the biggest thing.
Yeah.
There are a lot of other cuts surrounding like community-based services,
Hmm.
but that sort of is more dependent on the state. And for California, I think it's a little bit up in the air still if like a lot of these community organizations are going to be able to continue running the way that they are.
Yeah, I think this is such an important and critical area. And I think that navigating healthcare access is obviously something that needs to be tapped into on a much larger level. But then again, we have to consider it in the context of what's feasible, considering all the cuts you just mentioned and the effects on that. And then just considering the needs of the reentry population and all of the kind of admin hurdles, when navigating healthcare, but also competing needs like housing, and you said like in between
Yeah.
employment. So yeah, it's really important work that you're doing, I think, so we can identify how to like expand our services better to serve the population. Um, and kind of related to what you just discussed a little bit, what is something that you found most surprising in your work or your research?
I guess the thing that was most surprising is sort of just how overwhelming the process of applying for Medi-Cal is.
Yeah.
For like a program that is supposed to be made to be accessible for people who don't have a lot of resources, it
Hmm.
seems to be very intimidating to apply. There
Hmm.
is just a bunch of paperwork that you need that you might not know how to get if you don't have sort of an advisor or someone to help you sign up for. You have to have like a state ID or a
Yeah.
driver's license or something like that. You have to have all of these things, which a lot of people who are applying for Medi-Cal might not have. And so it sort of surprised me that like there are such strict requirements for this program that is supposed to be helping people get through a tough time. And,
Hmm.
it's not as accommodating or accessible as I think it should be.
Yeah, yeah, absolutely. The admin is definitely something that came up a little bit in my research too, because some of my work I've been doing this summer is creating kind of fact sheets for various stakeholders for education on kind of critical topics within reentry. So healthcare access was one that I did, especially after we had our initial conversation. I just kind of wanted to dig into this gap and these barriers a little bit more. And yeah, the administrative burden seems pretty high, which is definitely why it's good to kind of link people to the essential services they need. And when I was doing a little bit of research on my end, something that really stood out to me was just how medically vulnerable the first 2 weeks are after release from incarceration.
Yeah.
I saw a statistic, let me see. It said that mortality risk is heightened by 12 times during these first 2 weeks, often
Hmm.
due to preventable causes like overdose. So yeah, when we're thinking about this kind of critical 2 week period, in addition to people securing like stable housing or employment, like healthcare access is really something that cannot be overlooked, because these numbers really just show like how necessary it really is. Um, and then something else that came up in my research a little bit was considering health from a different angle. It was really interesting for me to learn about health from a more social perspective. I was looking into the 2023 US Surgeon General's advisory, which was all about the epidemic of loneliness in the US and isolation, which was especially exaggerated after COVID. And it stated that the mortality impact of social disconnection was similar to that caused by smoking up to 15 cigarettes a day, which I thought
Jeez.
was, yeah, I thought that was
Yeah.
um, so profound, like so
Hmm.
impactful for something that we don't necessarily think is immediately tied into health.
Hmm.
And then we're seeing this kind of social disengagement in all kind of sectors in society, really. Like we've seen like workplaces and schools become more isolated. So it really is important to kind of take a community approach, like you mentioned too in your work. Um, but then kind of going back to the this critical gap of the first 2 week period, it really is important to kind of first link people to the medical care that they need. Um,
Hmm.
so kind of like when we think about some of these gaps, how do you envision ACURI kind of utilizing or implementing some of this research? And maybe
Hmm.
any like kind of concrete steps or ideas you think could be most beneficial to clients?
Yeah, I think starting off just having sort of a guide sheet or like an FAQ sheet
Hmm.
for clients to sort of look at and reference, or anybody in the organization to like help people use
Yeah.
Medi-Cal and sort of how to sign up is definitely something that would be really helpful for a lot of these people because like signing up for Medi-Cal, like it takes a while for the papers to be approved and everything, and the application to actually go through. So it's very important that these people get on to signing up for Medi-Cal like as soon as they're released or as soon as they can, just so that
Hmm.
they like don't have a large lapse in coverage. I think that very specifically as well, I've answered some questions that I think can be very helpful for clients, like if they're moving to a different county, like what is the process of shifting their Medi-Cal from county to county, and how do they maintain coverage? How do they make sure that they can still go to the doctor and are still getting their medicine, and whatever they need while in that transition period? And so I think
Hmm.
that Acuria can really just use a lot of that, just word for word from my project sheet,
Yeah.
and sort of create like a pamphlet or some sort of guide, just to sort of help people figure out anything that they need regarding Medi-Cal.
Yeah, I think that's a great idea. And definitely in addition to like kind of the steps and overall flow of how to enroll in this, I love your idea of kind of like an FAQ as well, because I feel like there are just so many like little questions that even pop up for me as you speak, like talking about the process of like if you're moving, you're switching counties, or even like what the average length of time is to get it reinstated. I think a lot of this information would be really useful, not just for clients in terms of like helping them enroll, but even other stakeholders too, kind of realizing, kind of how crucial this need is and like how
Yeah.
best we can kind of work together to connect people to get this done. So yeah, I think that's a great idea. And I was reflecting about this question kind of for just kind of like the public health perspective and the work that I've been doing. And again, I kept going back to kind of thinking about health from a social perspective. And it was kind of full circle because this past weekend, Acuria hosted its very first community day, which was really cool. So it brought together people ranging from like board members to clients to judges and just kind of serving as just kind of like a safe space for people to connect, have fun, relax, enjoy the
Hmm.
weather, be outside, and talk to each other. And it was really cool. And I think Wyatt just sent out an email about it, but he had a takeaway that I really liked. And he said, my favorite thing about the event was that you couldn't tell who was a judge, who was a client, and who was there to show support. We're all just together. So
Yeah.
I thought that it summed up the event really well, and it just showed again, since it was the first one, it was just kind of cool to consider the ways that a Curii can kind of expand its reach and also incorporating the work that you're doing too. So first getting people kind of like the material needs and resources to support their like physical and mental health, but then also kind of taking the step forward to also kind of foster social connection and community. And that's something I really liked about this organization. It's kind of really bringing a lot of like cross-sector collaboration together. Um,
Yeah.
which is also kind of leading into my next question. Do you think there's any future avenues for more collaboration between policy interns and MPH interns? Because it seems like we worked on a little bit of similar projects almost, even though you were definitely more policy and healthcare focused, and that was just kind of a small part of the research I did. But yeah,
Yeah.
I was just curious from your perspective if you had any kind of future project ideas or just kind of general areas of research for people who might be future policy interns here.
Yeah, for sure. I was thinking about this, and if I had more time, that's sort of how I framed it.
Yeah, yeah.
Is that like I think I would look into more like actually interacting with a lot of like the local organizations
Mhm,
and
mhm.
community groups that
Yeah.
help with signing up people for Medi-Cal or help with X, Y, and Z and whatever people need, and sort
Mm,
of seeing at their level what are the challenges that they face and sort of combining that with my research and like figuring out like basically what both sides needs and like how we can best collaborate and fix a lot of those issues.
yeah.
I also thought about more policy things and how I would say that there is a lack of push for um like Medi-Cal or healthcare insurance, any sort of stuff like that. Like there's no real policy sphere for that.
Mhm.
Um a lot of the issues that I think that these people are facing are not being covered by politicians or by any group really.
Yeah.
And so I think something that could be researched more into is how do you sort of advocate more on the
Mhm.
policy side? How do you get like legislative stakeholders involved in these talks? And how do we sort of resolve a lot of these issues that we're seeing on a policy level?
Yeah, I was having a really similar thought too when I was thinking about kind of the kind of one-page fact sheets that I'm making, mostly more for community stakeholders, but I think there is a lot of potential to kind of tap into more policy advocacy as well. So I think it would be really useful for future like policy interns and MPH interns to kind of look at these topics, talk about them together, and then kind of you taking the side of turning this into like a policy or legislative brief that can be used more for that advocacy purpose. And then I can kind of take more of a community perspective and bring it into different stakeholders in the justice system.
Yeah.
Because, yeah, I think there are so many important topics that we both analyze in kind of a little bit of a separate way, which is so important. And it provides a lot of opportunity to kind of bring this out to different stakeholders. So yeah, I really like that idea too. Um,
Mhm.
and I like that framing of thinking about like what you would do if you had more time here, because I think it does set up kind of the organization for more success with future interns, but also kind of might help you to develop any kind of like future insights or areas of research that you want to explore, just kind of like down the line in your career. Um,
Mhm.
and that also kind of leads me to my last question. I just would love to hear kind of your major takeaways from this internship overall, how the work you did kind of influenced the way that you think about either policy, the justice system as a whole, or kind of influenced any future fields that you might want to explore in the future.
Yeah, I would say one of the biggest takeaways I had from sort of this internship and the research that I did is the importance of community programs and community groups
Hmm.
that help sign up people for government programs, help them just on a daily level, getting like
Yeah,
helping them get whatever they need. Because when I was starting my research, like I started from complete scratch. Like I didn't really know anything about applying to
yeah,
Medi-Cal or healthcare
right,
insurance or anything like that.
right.
And I would say that's probably the same for a lot of the people that are, like a lot of the clients that are applying. They don't really know anything. They're sort of just thrown into the deep end.
Yeah.
And so I think that a lot of the services that community like organizations provide is just so essential in like
Hmm.
helping these people figure out this is where I'm going to live. This is how I'm going to apply to health insurance. This is how I'm going to get my driver's license. It's so essential to their daily lives. Just helping them out with everything, especially when they probably feel very overwhelmed because, like, I felt
Hmm.
overwhelmed and I'm not even applying, right?
Yeah, yeah.
So I think it definitely influenced the way I think about sort of more local policy and like
Mm,
local level politics, just
yeah.
because it is very important, all of these things. And these, like a lot of the changes, the most impactful changes that can be made is going to be on that more local level instead of like sort of a national or federal legislation, is just community work and community organizing.
Yeah, yeah. I really love that perspective. And I think it's important also to take into account as a career I might potentially expand in the future. I know a lot of the clients we serve right now are primarily in California and the Northern District. But yeah, I'm just envisioning just any future expansion and how that would definitely bring up kind of changes in policy throughout the country, depending on where people are located, and then the different kind of challenges this might bring up for anything for healthcare, insurance, things like that. So it definitely is essential to kind of consider like the logistics of local policy too and the work that we're doing.
Yeah.
And yeah, I kind of had a similar takeaway. It kind of reinforced the importance of kind of community organizing and CBOs, which I already learned a lot about from public health in grad school. But I think this internship also really reinforced for me the importance of kind of cross-sector collaboration. Because I think when I first started this internship, I just had a lot of questions about the extent to which public health could be applied within the justice system, just since this was an area that I wasn't too familiar with at first. But now after these 10 weeks, I'm realizing, oh my gosh, there is so many opportunities, not just in the justice system, but like in all systems throughout the country, like healthcare system, just like everything on a structural level. There's so much I think potential for change and benefits when people just from different backgrounds kind of work together and share their ideas. So yeah, I had similar different takeaways and yeah, it was interesting to kind of meet with different people and different stakeholders to kind of see their perspectives too.
Yeah, definitely.
Yeah. Well, I think that was all of the questions that I wanted to go over with you. I felt like that kind of wrapped up our work pretty well. But if there's
Yeah.
anything else you wanted to discuss, let me know. And if you ever have any future questions as well, you have my email. You can always get in touch with me. Any questions about grad school or literally anything, let me know.
Yeah, will do.
Okay, perfect. Well, thank you so much for your time. I'll update
Mhm.
this recording link. I'll send it over to you and to Wyatt, and he can get it posted wherever he needs to.
Okay.
Okay,
Okay.
perfect. Thanks so much, Griffin.
Bye. Thank you. See ya.
Bye.